My name is Peyton. I'm one of the directors of education at Abide, and we're super excited to help the ECHO group carry out this message to anybody on the spot by asking, what does HIPAA stand for? Just know that it stands for the Health Insurance Portability and Accountability Act. What does that tell you about what you should be doing as a healthcare provider, in the state of California or New York, wherever you may be? Not a whole lot. So we're just going to focus on that last word, act, hopefully come up with an action plan for you in your office or you in your practice. So first things first, HIPAA is not meant to be a barrier law. It's more of just a permissive law that's supposed to help guide us on how to share information, who to share information with, and then of course, what's the safest way surrounding sharing that information while protecting yourself as a practice at the same time. And who we are at Abide, just really briefly. We're a technology company based outside of Tampa, Florida. As Laura said, I'm working from home in St. Petersburg. We're comprised of HIPAA experts, and we do this education for behavioral health practices across the country. Not only do we do the education, we also provide our own solution, which we'll be showing you really, really briefly at the end to try to help you learn how to manage everything we're going to go over today. But education is our main goal. So first we'll go over just kind of the current state of HIPAA, a few of the more recent trends, what we can expect from the next several years from HIPAA, from these audits that are happening. The next major piece, we'll go over how to achieve that HIPAA compliance. What does that documentation look like that your practice, that your office, that your company is supposed to have to protect itself in the case of a breach or an audit? Of course, we'll go over a couple examples to see how that fits into your day-to-day. Few COVID-19 updates, and then at the very end, just really briefly, we're going to show you how we solve some of these problems with HIPAA and how other people across the country enjoy that stress-free compliance. So why HIPAA? It's been around since 1996. Why all of a sudden this sudden increase of focus on it? Long story short, you're all prime examples, just that increase of technology. You're using the ECHO group for your EHR, probably for your telehealth, your text messaging. In addition to that, you're probably also using a third-party billing system. You're sending emails with PHI, and with that information being stored more on a computer or in the cloud, it opens us up for a different type of security breach. No longer does somebody have to physically break into your office to have access to that protected health information. Theoretically, they could be thousands and thousands of miles away and still have access to that information. So HIPAA is really in place to reduce the possibility of that happening, of course, as much within reason as we can expect. Unfortunately, the Office for Civil Rights estimates that only about 6% of covered entities are actually HIPAA compliant. Now, that doesn't mean that practices aren't trying, or maybe they're malicious in their intent of non-compliance. It simply means that not everybody is totally and completely aware of what it means to be HIPAA compliant to the government standards. And we really see two main reasons for that lack of compliance. One is just a lack of time. You're probably rushing around trying to take care of your patients, managing your staff, working with billing, doing insurance, all in the middle of the pandemic while also worrying about your own mental health. And HIPAA becomes one of those things that just kind of falls lower and lower down the totem pole, not because it's not important, but each day brings its new set of challenges and new set of immediate action items that you have to act upon. The second main reason we see that lack of compliance is just a lack of education. So nobody's really taken the time to help you as a provider, as a doctor, as a counselor, and tell you what it means to be HIPAA compliant, aside from just, hey, you need to be HIPAA compliant, and then you're expecting to just kind of go from there. So to kick that off, the main governing body who is responsible for HIPAA compliance and for these audits is called the Office for Civil Rights. You'll probably hear me call them the OCR. Within the last year, they've issued several new guidance documents surrounding HIPAA geared towards the practices. They've also issued a record number of multi-million-dollar fines in response to a record number of HIPAA complaints. And I'll touch on those complaints a little bit more. And then a big takeaway from this, there's a huge focus right now on patient right of access and enforcement. I have an example later on about the 10th fine they just enacted. Earlier today, they issued their 12th new fine. So again, we're not seeing that go away anytime in the near future. So I touched on that complaint. We like to show this graph just to show you that this is a major way that these audits are being triggered. And 46% of complaints result in audits against practices. Now, Just like you guys have that increased access of technology, patients clearly have the same increased access. We all are walking around with smartphones. We can quickly Google search, hey, should this happen to me? Should it not? Then they're led to a new anonymous reporting portal within the Office for Civil Rights, and they can quickly file that complaint. In addition to those complaints, we're continuing to see those increased fines. So you'll see that huge jump there from 2015 to 2016. You might wonder what caused that. That's really when the government started to do more and more proactive audits instead of just responsorial audits to people who were breached or there were complaints. They're being more and more proactive. And what does the government do when they find oil? Well, they're going to continue to drill and drill and drill. So again, we just do not see that ending anytime soon. So who was fined? Traditionally, we think of these really large multi-location, several thousand hospitals, and that's absolutely true, still the case, but they're diversifying those efforts to focus on behavioral health practices, eye care, chiropractic practices, as well as your business associates. So we'll get into that a few slides from now. When it comes to these audits, everybody is in the governmental crosshairs, long story short. So unfortunately, I can't ask each and every one of you about how your practice defines that HIPAA compliance. Some general answers we typically receive, though, practices describe having what we would call a culture of compliance, where everybody kind of knows, almost common sense wise, what to do versus what not to do. You probably don't leave files lying around. You know to lock your doors. You lock any cabinets where those files are stored. You probably call to confirm that a patient is actually a patient before you share any information. You have that culture of compliance. What most practices are missing, though, is just that documented proof that shows that that culture of compliance actually exists. If you were going to be audited, if you have a breach and are expected to show proper documentation, unfortunately, that auditor is not going to follow you around the office for 3 or 4 days to see how you react in certain situations. What they're going to do is send you a letter or an email that says, hey, we need ABCDE documentation before this date, and then you would be expected to hand that over and be able to accurately portray what's happening in your office without them ever stepping foot inside your office or your room, whatever we want to call it. So most providers view HIPAA as just a pretty clear-cut, one-piece program of just protecting that information, making sure that it doesn't get sent out. I really want to help change your mindset a little bit and focus on how an auditor is going to view HIPAA, but also how we as practices, how we as healthcare providers can reduce the possibility of any of that information being leaked, breached, shared unintentionally, whatever it may be, through this documentation. So the very first thing that they would ask you for in the case of an audit, and the very first thing that you should have as a healthcare provider, is something called the risk analysis. This is the first step in becoming HIPAA compliant. It is also a requirement through the security rule. And you can see here on the screen just a brief little definition that is from the Health and Human Services website. So functionally, it's just a questionnaire that's supposed to help you as a practice or as a provider identify any potential risks or vulnerabilities to the information that you're housing in your office within 3 different categories of safeguards. Those safeguards would be your physical, your technical, and your administrative safeguards. And I'll show you a couple more examples as we get towards the end. We go through Abide, but for now, some examples questions could be, how many people have keys to your office? How often are passwords changed? Do your computer screens face away from the waiting room? Again, just little questions here and there meant to help you identify, well, that's a higher risk. I never really thought about that before. And then you would then be expected to go back and to mitigate that risk. This risk analysis is also a prerequisite for the Quality Payment Program, or MIPS. So in addition to being required for HIPAA, it is also required through that Quality Payment Program. And again, your compliance has not been achieved without having this in place first. Like we said, that is a requirement through the security rule. The second phase that we're going to be talking about, these are all requirements through the privacy rule. The privacy rule is really focused more on just that ongoing compliance, making sure that it's not a one and done type situation in your office. It's a focus throughout the year. So the first phase, or the first step rather, of that second phase is just risk mitigation. So now that we've identified some of those medium or higher risks through our analysis, we then have to mitigate those risks. So kind of an elementary example, so just bear with me a little bit, but let's say that maybe we have identified that we do not use a cover sheet when we're sending our faxes. That's a very high risk. We always need to use a cover sheet. How do we mitigate it? Well, clearly we just mandate that cover sheet. So again, pretty elementary example there. Really just goes to show you that the auditor, whoever it may be, is looking for progress within your office. They don't expect you to be perfect first thing off the bat, but they want to be able to see that progress. They also want to be able to see that you have one of these in place in the first place. Once we get all that mitigation going, the next step of being HIPAA compliant is staff training. So all of your staff, including any types of part-time staff, doctors, counselors, they must be trained at minimum of once per year. This includes any type of new staff that you hire on. They have to be trained within the first 90 days of coming on board. The government likes to see this in what's called a modular type format, which just means that there's a quiz at the end. That quiz is meant to show that one, everybody actually understands what the training was about, and then two, as either the HIPAA compliance officer, the owner, the manager, it gives you that documentation to prove that that training actually happened in the first place and is recurring every year, year after year. Next would be your policies and procedures. So think about these. If you were going to be audited by the IRS for your taxes, these would be your receipts. This is really going to be what spells out what's happening in your office. And it should reflect the questions in the security risk analysis. So this could be your email and fax policy, your social media and disclosure policy, new employee onboarding, employee offboarding, patient right of access. Again, that's a major focus right now. You must have a policy in place that directly spells out how you share protected health information. Next would be your patient authorization consent forms. Fortunately, most of the practices, most of the doctors or the offices that we work with have these in place. The only disconnect here is that by having them in place, it makes practices have a false sense of security that they are HIPAA compliant, when in reality, they're missing all of these other pieces. And now I'm not telling you to not have these signed. Of course, we need them signed, but it is just one piece of that bigger puzzle. And a couple of these audit letters that I'll show you a little bit later on, you can see they don't even get around to asking for these forms, unfortunately, because it's the only thing that everybody has. Let's be totally honest. It's everything else that they're going to want to see. And with these forms and with the policies and procedures, we have some people, or we've seen some people, just download generic versions of these documents. I just want to caution against that. Be sure to tabulate or to edit those documents so that they accurately reflect what's happening at your practice, even as something as simple as the location for your practice, the phone number, as well as any state laws. So HIPAA is a federal law, but states have the ability to further restrict those laws. You want to make sure any of those further restrictions are reflected in those policies and procedures. So next would be your HIPAA manual. This does not have to be that traditional 4-inch 3-ring binder that's probably sitting on a shelf somewhere close to you at the moment. It doesn't have to be that. Just needs to be somewhere that's easily accessible and well organized, where you keep all of this documentation that we're discussing. There's an audit happening right now where they're asking for the last 6 years worth of training documentation. So again, highly encourage you to have this just very well organized. I'm also going to encourage you to have all of this documentation backed up in some type of cloud-based system, just in case something, God forbid, happens to your practice. It's 2020, I'm in Florida, we've got hurricanes, everybody else has floods and fires and storms and tornadoes. So this year is not the year to mess around with not backing up that documentation. Definitely keep that online somewhere and easily accessible. Next piece would be your business associate agreements. These are agreements signed between you and any type of third party who has access to or who could have access to your protected health information. So this absolutely would be the ECHO group. I'm for sure certain that they've sent these out to you. This could be any type of third-party billing. If you work with a paper shredder, even a janitorial staff, you would want to have these associate agreements signed with them. Just in case of a breach, it would offset any type of liability from you onto them. So for example, there was a situation in South Florida where a large hospital was partnered with a third-party billing company. That billing company was breached. Unfortunately, they posted about 9,000 patients' credit card numbers to their website. Clearly a major audit, a major breach of information, or a major, HIPAA violation. It triggered an audit against not only the billing company, but also the hospital. The hospital did not have that security risk analysis. They also did not have a business associate agreement with the billing company. They were fined $500,000. But had they done that initial security risk analysis, they would have found that it was a very high risk to not have these business associate agreements. So it was completely unavoidable had they just had all of the puzzle pieces in place. Next, going back all the way to that very first thing we talked about, that security risk analysis. It has to be done every single year. Now, when practices go back to do it year after year, it's just kind of like reinventing the wheel year after year. Try to combat that just by making changes throughout the year as you reduce those risks, as you implement new technologies or make changes within the office. You always want this just to be an updated and accurate portrayal of what's actually happening in your one, HIPAA compliance program, and then two, at your practice, your office, wherever we may call it. So again, it's just about those pieces coming together. It is very important that our patients feel safe and that they know we are protecting their protected health information. You are working with them on some very private counseling session information. You have to protect that. But to take it a step further, you also have to protect yourself as a practice, and you do that by having this documentation in place to either one, reduce the possibility of anything happening in the first place, and then two, showing that you've done everything you could in case something actually does happen. Unfortunately, only about 17% of practices have a security risk analysis. And to take it a step further than that, only 6% of the practices who were audited were actually able to produce a security risk analysis, as well as any of the other supporting documents like their policies and procedures. So it really is in the minority. Again, why we're seeing such an increase in those random or more proactive audits. Which brings me to the different types of triggers. You've heard me mention all three of these throughout the last several slides. The first and the probably most common way to trigger an audit is through a complaint. This is not only a patient complaint. Employee complaints are another major way that these investigations are triggered. I always like to say you could be, the sweetest peach in Georgia, and some people are still not going to like peaches. People like reasons to complain. And again, 46% of those result in audits. The next is the security breach. It doesn't have to be that example that I gave about the 9,000 patients who were affected. It could be something as simple as we forget to blind copy email addresses, or maybe we send a form to somebody that was already a filled out form instead of a template. That also constitutes a security breach, can trigger an audit. The third way, just good old-fashioned bad luck, functionally, or where they pretty much just pull your name out of a hat and send you that letter saying, hey, we need your documentation. We touched on this earlier. Who can be audited? Again, any covered entity, any business associate, even Echo Group, you guys could be considered. You are a business associate, you could be audited. They're very, very real. They're focusing on everybody at the moment. And just to briefly run through a couple of those penalties, I've touched on this a few slides ago, but there are different tiers to these fines that they're issuing. So tier 1, tier 2, they typically have that documentation in place. We could have avoided it, had we maybe worked a little bit harder. Tier 3 and tier 4, there have been no attempts at violation or correcting the violation. There's been no attempts at even trying to identify what those risks might be. Traditionally, we've seen the smallest fine. It was about $10,000. That changed 2 weeks ago. The smallest fine is now $3,500. Again, really goes to show you that they're trying to diversify those efforts. And we don't see this too much, fortunately. This could result, let's say, some criminal jail time if you had to terminate an employee. Let's say they went rogue or whatever, they stole your information from the Echo Group, from whoever it may be, and then they sold it on the black market or wherever you sell that information. That could result in criminal jail time for that employee simply because the PHI that you house is 25 times more valuable than any type of credit card information. Also, as a provider, if you do not have the proper policies in place about offboarding that employee, how you keep that PHI safe, could also result in a financial penalty against you. A few different examples here, just some recent fines paid to the Office for Civil Rights. This is a major, major example. So you've heard me mention this patient right of access before. This happened earlier this month in November. Since then, they've settled 2 more patient right of access settlements. And we wanted to share this one because it related to a psychotherapy practice. A patient requested their own therapy notes. The practice refused to hand over that information because it did contain private counseling session information. They didn't, however, share any of the other information they could have shared. It was a smaller practice. They ended up being fined $25,000 for not sharing that information. So again, a couple takeaways there. Very, very important. It is a focus, so we have to understand what the differences are between sharing a PHI, what we can share versus what we cannot share, even in that mental and behavioral health. So while you are handling that sensitive information, there is some information that you are able to share as that provider. Similar to that business associate agreement example I gave earlier, this happened earlier this year over in Utah. So this was a dispute between that healthcare provider and one of their business associates about access to records. The healthcare provider complained, triggered an audit. They found that the healthcare provider did not have a business associate agreement. They also did not have a security risk analysis, and they were hit with a $100,000 fine, even though they're the one who initiated the complaint. So they really don't care about who files the complaint or really how that complaint even gets started. They only care about who's in violation at the end of the day. Of course, we have to make sure we have all of those puzzle pieces in order just to lower that risk. And then if something does happen, if we have to be fined, it's going to lower the amount of that fine. Another example we see a whole lot, this happened to a dental practice over in Dallas. A patient left a really terrible Yelp review about the practice. The dental practice, completely understandably, they felt the need to just come to their own defense a little bit. However, they confirmed the patient's last name. They shared more of their health information online in this Yelp review. The patient complained, of course they did. It slapped the practice with a $10,000 fine. So I'm not completely against responding to reviews. I think it's just very, very important to have a really canned, generic response for those reviews. So, hey, thanks so much for reaching out. We take great pride in our behavioral health care. Whatever it may be, you just want it to be really canned, really generic. Take it a step further. Again, I'm repeating this just for importance. Have those policies in place that address any type of social media and disclosures. This includes if you're using any type of testimonials. You want to have those proper policies in place as well. I really like to show these federal and state audit letters just to show you what it's going to look like or what it could look like. It kind of takes a little bit more of the mystery out of it. This happened to actual Abide clients. This happened to a client over in Louisiana, a large location practice. They had 6 different locations. From one of their locations, a laptop was stolen. They decided to self-report that to the Office for Civil Rights because it was a lot of PHI that had been breached, that had been stolen. It triggered an audit. They asked for all of their different documentation. It took over a year for them to finalize just because they were so thorough. However, the practice was able to prove through that documentation that, hey, we did everything we could within reason, of course, to prevent this from happening, and they were let off without any types of fines or warnings, no further action items for them. Another example, unfortunately, this happened earlier this year at the beginning of a pandemic. This office manager was furloughed, so the practice had to temporarily bring on a temp employee just to help send emails, run their social media accounts. That temporary employee sent out an email to about 400 patients without blind copying or BCCing those email addresses. Email addresses are PHI. They cannot be shared with other people. It triggered an audit. Of course it did. This is their audit letter from the state attorney general. They asked for those business associates agreements with all of their third parties, all of their different policies and procedures within those 3 safeguards, as well as their risk analysis conducted immediately before their disclosure. So not just one risk analysis from whatever, 2 years ago, the one that they conducted immediately before the disclosure because they wanted to see that current representation of what's actually happening in their office. Now, similar to that last example, they were able to provide everything. They were let off without any types of warnings, fines, corrective action, even though it was that huge human error breach. Clearly, we are still in a public health emergency, unfortunately. So we just got a quick slide about this. I'm not going to spend too much time on it, but just wanted to share that there are some strict limitations on sharing PHI. However, we can share it with any type of public health authority like the CDC, a contact tracer. We can share it with anybody who's potentially at risk of becoming sick or being infected. We can also share PHI with any type of disaster relief organization, American Red Cross, FEMA. However, you want to be sure that you're only sharing that information when trying to prevent further spread. It's much better to be conservative instead of just freely sharing that information. Now, at the beginning of the pandemic, the Office for Civil Rights issued waivers allowing practices to use non-secure telehealth applications. Echo Group, their telehealth application is HIPAA compliant, it's secure. If you're currently using something other than that, maybe Google Meets or FaceTime, that waiver allowing you to do so is ending in January. So I would highly encourage you to either go back to Echo Group, partner up with them, seek other options. You just want to make sure that it is a HIPAA compliant option. And then in turn that you're going back to update that security risk analysis as well as any type of disaster recovery plans. So some questions for you all to consider. That's functionally the main topics that we're going to go over. Just some questions for you. That risk analysis, have you done one? You want to be sure that it covers all three of those safeguards. Some practices have a little bit of a false sense of security if they're working with an IT company. Typically, that IT company only handles that technical piece. You would still be responsible for the physical and the administrative questions of that questionnaire. Your two, how do you draft that documentation? What do you have? How do you update it? Who's in charge of updating that documentation? Is it you? Do you have an office manager? Your HIPAA training, same question. How are you going to execute it? Who's doing those quizzes for you? Is somebody grading them? How do you make sure that they're done year after year? And then, of course, the fourth question, how do you stay up to date on all those latest HIPAA changes without having to rewatch this recorded webinar every month? I'm sure that you all have much better things to do than either to rewatch this or scour the Health and Human Services website. The biggest question of all, again, rhetorical, since I can't ask each and every one of you, but if there happened to be an audit, a data breach, or a complaint tomorrow, do you feel comfortable with your documentation? Unfortunately, typically the answer to that is no, which is why we're really excited, again, to be partnered with the ECHO Group to at least make you aware of all of these different requirements that you are expected to abide by, expected to maintain. And that's kind of where we come in. So your head might be spinning. It is a lot of information. That's why we're partnered with ECHO Group, just to hopefully make your lives a little bit easier through our really user-friendly software designed specifically for the behavioral health practices, whether you have a typical brick and mortar store, or maybe it's more focused towards online and telehealth. Really easily implemented, and you're able to sustain your HIPAA compliance program. We know that you don't have a lot of time to probably even eat lunch, let alone manage a 40-hour-a-year HIPAA compliance program. So we're not talking that much. And then the best part, we have audit protection. So if something were to happen and you really have no idea how to proceed with that audit or breach, we would be there to help you and walk you through each one of those steps. So just before we wrap up, I'm going to briefly run through Abide. So we call ourselves a software. It's more of just a web page. So this is just abide.com. You log in like any type of social media page. There is no protected health information stored in Abide, so you're able to easily access it from your computer, a phone, tablet, whatever it may be. Once you log in, it drops you into your dashboard here. This is going to completely take over that HIPAA manual, make it a little bit more user-friendly. So the first little thing that you'll see up here is just our bell icon. We're going to ping you whenever you have any action items, anything that you need to complete or address to maintain that compliance. We're talking maybe 10 minutes every month or so. And for most of you, the very first thing that you're going to want to do is that security risk analysis. Remember, it's within those three different safeguards there. Ours is about 75 to 85 questions, generally takes about 30 minutes to complete. So I'll click through just so you can see a few of those examples. Really easy, no, yes, don't know questions and answers. That's a great thing. If you don't know, simply click you don't know, and then we'll circle back to it the next few weeks just to bring your attention back to it. Now, instead of doing those same questions year after year, we're going to automatically save this for you at the end of every month. We'll keep that right here in our view history page. And anytime you make any changes as well. So really the only time that you have to go back and address this security risk analysis is if you have any of those medium or higher risks. And that's what we're going to push you through that ongoing compliance section. So let's say that maybe, in my scorecard, it says that I have a very high risk. I have not yet identified all of my business associates. It's going to tell me how to mitigate that risk once I say, yes, we've identified that ECHO Group is a business associate. I change that to yes, drops it down to a very low risk, and then I'm not responsible for answering that question ever again. So again, the only time you're really having to go back and address any of those questions is through that ongoing compliance piece. We're just going to push that to you there. And if you make any changes to this section, same thing, we just update that little scorecard. So right now, is our telehealth solution HIPAA compliant? Well, we use ECHO Group, so we know that it absolutely is compliant. We go to the next question. Next big piece would be your training. So not all of our videos are about 10 to 12 minutes long, and we push new videos once every 9 months. So you're not watching the same video year after year after year. And your employees would not need access to this back page to have access to this training. What we'll do is just automatically send it out to their emails when it's time for them to complete that training. Now, As Laura mentioned, I'm originally from Alabama, so y'all are going to see some country music themes in here. And let's say that maybe our sweet friend Reba here has forgotten to do her training. Hopefully everybody can still see my screen, but it's going to pop up in her inbox as long as my Wi-Fi works. Looks just like this, says, hey Reba, here's your new employee training. She clicks it's movie time, watches this quick little movie here. This one's less than 12 minutes. Once she's done, it's going to drop her into the quiz. Remember, they like to see that modular type format. Now, we're not really in the business of failing people, so if Reba, God love her, she thinks that HIPAA stands for female hippopotamus. That's not the case. We have to have a conversation with her about acronyms, but it's just not going to let her go on to the next question until she answers it correctly. That's to keep her from having to go back, rewatch the video, and waste any time there. Now, for you on the backside, as that HIPAA compliance officer, as the owner, the manager, it's just going to automatically generate a little certificate with her name, as well as the training that she finished right here and the date that she finished it, giving you that strong documentation piece that the training was actually completed for that year. So then the following year, we do the same thing and we just send it out automatically. Another huge piece are going to be your policies and procedures. So we have 25 in the system. These are not templates that you have to go in and update one by one. Everything in the system is just generated based on the information from your profile page, as well as how you answer that initial security risk analysis. Remember, in those requirements that we covered, you want your policies to reflect that security risk analysis. So let's say this is a good example. So let's say that maybe in our security risk analysis, we said that we do not use a cover sheet when sending a fax. That's a very high risk. It says so in my policy. We always want to use that cover sheet. Once I go back and I update that in my security risk analysis, this bullet point gets deleted. So it's not updating one and then coming in here to figure out how everything else was affected. Everything is just linked together and updated in real time. Same thing with your title, your name. If you change that in the profile page, everything is then updated. Once you have that cover sheet, we'll just generate it for you here. And I'll scroll again just so you can see a few more examples. We also have your patient health data request policy. So this is something that would be state specific. In the state of Florida, I have 30 days to hand over any type of requested health information. State of Texas, they have 15 days, but up in Maine, where my practice is, we also have 30 days to hand that information over. So if that were to change, we would just automatically change that for you. If you have previous training documents, or maybe you do have a dusty security risk analysis that might not have been touched in a little while, you could always upload that here into our document repository. Basically just works as your Dropbox to keep everything safe and sound together so it's not scattered about. It's all, again, located in this little Dropbox. For your business associate agreements, there are 3 different ways to do this within Abide. You could always email over our preferred agreement. We're always going to suggest that just so that you have something that's written to protect you as a practice. So you could email it over, they would sign it electronically, it gets uploaded back into the system. Now, if you have one that already exists, I'm not sure if Echo Groups is online or maybe you have a paper version, but you could upload that here. Or if it is online, maybe you have an IT company, or if the Echo Groups is online, you could just link it to their website here. That way, if they make any changes, it's updated on your end in real time. And that's functionally all of your HIPAA compliance requirements, or it is all of your HIPAA compliance requirements rather. So from the time that you sign up to the time that you are fully compliant, you have all that documentation, that risk analysis is done, your policies are generated, your training sent out, we're looking at about an hour, maybe an hour and a half, depending on the size of your practice and how many employees you would need to add. Once we add these new employees, it sends out that training. It's also going to send over their employee confidentiality agreement for them to sign. Another way to keep that information safe is by having this agreement in place. Autofills with their name. They would sign it electronically. Same thing, gets uploaded back into the system and is marked as completed. Now, if we have any questions, or if you have any questions about HIPAA, about Abide, how it works, any types of updates through maybe the CARES Act or whatever it may be, you could always reach out to our support staff here. They are fantastic. If they notice the same questions being asked kind of repetitively, maybe over and over again, they're just going to host and record a webinar about that, and they'll put that recording here just in your little latest updates section. You can see we had a lot of questions about social media, a lot of questions about email encryption, so we'll just post that for you there if/when you have time to watch it. I mentioned that audit protection earlier. If you were ever audited, if you were ever breached and you have no idea what to do, you could always click this Help HIPAA Emergency button. The entire staff is notified, and then we would be coming to run and help you pull that documentation or advise on how to proceed with that breach. So we're pretty much just your HIPAA experts on retainer. And that's about it. That's Abide. So you saw how easy it is. Now, if you wanted to sign up, and I'll put this on my slide again once I go back, you would just go to the pricing page, input, let's say that we were 1 location, 1 to 5, we would sign up. Now, in celebration of our partnership with the Echo Group, we do have a promo code for you through the 30th. If I can spell, it would be ECHO25. That is through November 30th. That gives you 25% off. So that would drop your monthly payment. If you choose to sign up annually, it discounts at 10% initially, then adds that 25% on top of that. So I will put that on your screen right here. Again, that's through November 30th. And that's that 25% discount. And like Laura said, you can always reach out to them with any questions. I'm also happy to share my information if anybody has any questions. And that's pretty much Abide. So I'm not sure if we're able to take actual questions. I know, Chris, you were probably answering some in the chat as well, but I am happy to hand that back over to you, Laura.
Yes, I'm not seeing questions, and that's not like the Echo family. But thank you so much, Peyton. That was a lot of information to go through. And just a reminder to everyone that we will send you a link to the recording by email, and reach out to your account manager if you want more information, or send an inquiry into info@echobh.com. I do also, while I have everyone's attention, I want to share with you our next Power Talk is 2 weeks from now. And that will on December 3rd at 2 p.m. And that will focus on utilizing your dashboards. It will be presented by our very own Dr. Kelly Stepura, who is our Chief Clinical Innovation Officer. We will provide details about the upcoming Power Talk with registration information in the email with today's recorded link. So keep a lookout for that. I'm not seeing any questions come in. You can also unmute yourself and join in if that's easier for you. No questions? Well, I know they'll come. I know they'll come to you. So reach out to Callie, Scott, or Dave, or again, you can just send an inquiry to info@echobh.com, and we'll forward your request over. Peyton, thank you. Thank you so much for sharing with us today. This is wonderful information.
You're welcome, Laura. Again, thank you all for the opportunity. Happy to help answer any questions. I know it's a lot to digest at first, especially. And so once it has a chance to marinate, again, happy to answer any questions.
Okay, well, thank you, everyone. Be safe and have a happy Thanksgiving.